Hello everyone, this is Dr. Minde and I would like to continue the lecture series on the anatomy of the larynx. We had discussed the mucous membrane made up of ciliated columnar epithelium and the vocal cords. Due to continuous trauma during phonation, they have stratified squamous epithelium. Then we mentioned that you have mucus glands that produce mucus to lubricate the vocal cords, the vocal folds. So that's it about the mucous membrane. Then we talked of the muscles being divided into two, the extrinsic, which are elevators and depressors of the larynx, and the intrinsic, which control the inlet of the larynx and also control the movement of the vocal cords. So for the muscles that cause elevation and depression of the larynx, remember the larynx is found anterior to the pharynx. So elevation of the larynx occurs together with elevation of the pharynx. So suprahyoid muscles such as the digastric, the mylohyoid, the stylohyoid, from styloprosthesis to the hyoid bone, all these cause elevation. Then you also have stylopharyngeus, salpingopharyngeus, and palatopharyngeus muscles, which are longitudinal muscles of the pharynx that will cause elevation of the pharynx. We also have the depressors of the pharynx, such as the infrahyoid muscles. These include sternohyoid, sternothyroid, and omohyoid muscles. So in the lecture series of the pharynx, just go and look at the muscular layer. We talked of constrictor muscles, which are circular muscles of the pharynx, superior, middle, and inferior constrictors. But remember, you also have longitudinal muscles of the pharynx, which include the stylopharyngeus, salpingopharyngeus, and palatopharyngeus. Okay? So the muscles that control the laryngeal inlet, we have the oblique arytenoid, so it runs obliquely, and you have the aryepiglottic muscle. Okay, aryepiglottic and oblique arytenoid. And these muscles, when they contract, they tend to reduce the laryngeal inlet. Okay, then we have muscles that will increase the length and the tension of the vocal cords. A good example is the cricothyroid muscle. So what does cricothyroid do? It increases the distance between the angle of the thyroid cartilage and the vocal process of the arytenoid cartilage. Increase the distance between the angle of the thyroid cartilage and the vocal processes of the arytenoid cartilage. So what happens when this is done? You're able to increase the length and the tension of the vocal cords. So as you can see here, the angle of the thyroid and the arytenoid vocal process of arytenoid cartilage. So when cricothyroid contracts, you increase the length and tension of the vocal cords. So this is the initial position of the vocal cord before cricothyroid contraction, and when it contracts, you increase the length and the tension on the vocal cords. So that way, you have increased the distance between the angle of the thyroid and the vocal process of arytenoid. So this was the original length and tension. Then after cricothyroid contracting, that becomes the length and the tension. So it has been increased. Then we have muscles that decrease the length and tension of the vocal cords. To increase, we were using cricothyroid. Now, what do we use to decrease the length and the tension of the vocal cords? In this case, we're using the thyroarytenoid. Thyroarytenoid is what we call the vocalis muscle. Thyroarytenoid muscle is the vocalis muscle. Okay, so this is your thyroarytenoid muscle. This is your cricoid cartilage. This is your arytenoid cartilage. This is your thyroid cartilage. So this is the thyroarytenoid muscle. So what happens? It pulls the arytenoid cartilage forwards. So if it contracts, it pulls its cartilage forward towards the thyroid cartilage. And what happens? You tend to shorten and relax the vocal cord. So this is the vocal cord. So if you pull this way, you pull forward, you shorten and relax the vocal cord. But cricothyroid was causing the pull on the other direction to lengthen and tighten the cord. But thyroarytenoid pulls the arytenoid cartilage towards the thyroid cartilage. That way, you shorten and relax this vocal cord. So this is your thyroarytenoid muscle. This is your vocalis. Your vocal cords are here. So if this thyroarytenoid contracts, it will contract this way. Okay? Thyroarytenoid, it will contract from, this is arytenoid cartilage, this is thyroid. Muscles contract from the insertion towards the origin. So thyroarytenoid, origin is thyroid, insertion is arytenoid. So you're going to contract this way. So when you do that, you shorten the vocal cords and they tend to relax. But cricothyroid, what was it causing? It was causing lengthening of the vocal cords and tension. So these are the movements of the vocal cords. Okay, as you can see here, during phonation, that's what happens. The vocal cords close up, and during inspiration, the vocal cords have to open so that air can move from the larynx to the trachea. So during inspiration, vocal cords open up so that air enters the trachea, and during phonation, vocal cords close up. So that's what we call adduction and abduction. During inspiration, they abduct. During phonation, they adduct. Okay, so the folds closing, that's adduction, and opening, that's called abduction. And remember, we said the space between the folds is the rima glottidis. You remember, between the vocal cords was rima glottidis, and between the vestibule was rima vestibuli. So the adductors of the vocal cords. Now we know the vocal cords have two types of movement. There is adduction, closing up, and abduction, opening up. So what causes closing up, adduction? We have the lateral precoarytenoid and transverse arytenoid. This is the lateral precoarytenoid, and this is the transverse arytenoid. So those are the two adductors of the vocal cords, lateral precoarytenoid and transverse arytenoid. So what do they do? Look here, this is your lateral precoarytenoid, and this is the transverse arytenoid. So when they contract, they cause the vocal cords to, if this contracts, it pulls this way and this way inwards, so it will cause adduction. If this contracts, they will cause the vocal cords to close. If this contracts, it will cause the vocal cords inside to close up. So they cause adduction, or just right and left vocal cords come to close to each other. So lateral precoarytenoid and transverse arytenoid. Then we have only one abductor of the vocal cord to cause the vocal cords to abduct, move away from each other. These are the vocal cords. So when the posterior precoarytenoid, this is the posterior precoarytenoid, when they contract, they cause the vocal cords to open up. That allows inspiration. This is a very, very important muscle, because when you have paralysis of posterior precoarytenoid, then you cannot breathe. So posterior precoarytenoid helps you to abduct the vocal cords to allow air to enter the trachea. So this is your thyroid cartilage, this is your cricoid cartilage, these are the vocal ligaments, and this is the posterior precoarytenoid, okay, from the cricoid to the arytenoid. And if you're to look at this large muscle here is the posterior precoarytenoid. So the oblique arytenoid and aryepiglottic muscle were altering the inlet of the larynx. Remember that. Then the transverse arytenoid and lateral precoarytenoid were causing adduction of the vocal cords. Now we are mentioning that this posterior precoarytenoid will cause abduction of the vocal cords. So what's the blood supply of the larynx and the lymphatic drainage? The arteries include the superior laryngeal artery, which supplies the upper half. It comes from superior thyroid artery. Superior thyroid is from external carotid. So external carotid gives superior thyroid gives superior laryngeal. That supplies the upper half. The lower half comes from inferior laryngeal artery, from inferior thyroid artery. Inferior thyroid comes from the thyrocervical trunk, which is from first part of subclavian artery. So when they ask you blood supply of anything in anatomy, don't ever mention an artery without stating the source. That is guesswork, because everybody knows that the larynx is supplied by laryngeal artery, the thyroid is supplied by thyroid artery. So when you respond like that, it's guesswork. So you need to describe. The upper half is supplied by superior laryngeal artery, which comes from superior thyroid artery, a branch of external carotid artery, while the lower half is supplied by inferior laryngeal artery from inferior thyroid artery that comes from the thyrocervical trunk, from the first part, okay, of the subclavian artery. Then the venous drainage is by the corresponding veins to this artery. So superior laryngeal vein and inferior laryngeal vein that will drain into superior thyroid and inferior thyroid veins. Lymphatic drainage of the larynx is mainly by the deep cervical lymph nodes. What's the nerve supply of the larynx? Again, nerve supply of any structure divided into sensory and motor. So sensory, you divide it above vocal cords and below vocal cords. So above the vocal cords, sensory supply is by internal laryngeal nerve, which comes from superior laryngeal branch of vagus. That's the response I expect you to give. Above the vocal cords is by internal laryngeal nerve, which is a branch of superior laryngeal nerve from vagus. So this is your internal laryngeal. Superior laryngeal branch. Vagus gives superior laryngeal, which divides into internal laryngeal and external laryngeal, as you can see here. So above the vocal cords, sensory of the mucosa is by internal laryngeal nerve. And below the vocal cords, sensory innervation is by recurrent laryngeal nerve of vagus, not the external laryngeal yet. So this is recurrent laryngeal going to give sensory to the area below the vocal cords. I'll repeat. Sensory innervation of the larynx mucosa. Above the vocal cords, internal laryngeal nerve, which is coming from superior laryngeal of vagus, and below the vocal cords is by recurrent laryngeal nerve. What's the motor supply of the muscles of the larynx? All intrinsic muscles. Remember, the intrinsic, the way we describe them here, okay? We mentioned that. You need to remember this. Intrinsic muscles are the ones controlling the inlet and the movement of the vocal cords, while extrinsic were causing elevation and depression of the larynx. So the intrinsic muscles are this oblique, arytenoid, and epiglottic muscles controlling the inlet. Then we have transverse arytenoid and lateral cricoarytenoid that will adduct, and posterior cricoarytenoid that will abduct the vocal cords. So basically, that's those are the intrinsic muscles of the vocal cords. So motor to all the intrinsic muscles of the vocal cords is by recurrent laryngeal nerve. This recurrent laryngeal nerve supplies all muscles of the larynx, intrinsic muscles of the larynx, except cricothyroid. Cricothyroid is supplied by external laryngeal nerve. And remember, cricothyroid is very important because we mentioned that it's the one that when it contracts, it causes the lengthening and increases the tension of the vocal cord. So it's very important. So vagus gives two branches to the larynx. Superior laryngeal that divides into internal laryngeal and external. Internal laryngeal is sensory to the upper mucosa above the vocal cords, and external laryngeal provides motor to cricothyroid muscle. Recurrent laryngeal supplies sensory to the mucosa below the vocal cords and motor to all intrinsic muscles of the larynx except cricothyroid, which has been supplied by external laryngeal nerve. So I hope that is clear. So you can reverse back and listen to what I've just said so that you get it very clearly, and that's how you're supposed to describe the nerve supply to the larynx. So the production of voice involves the generation of the sound, that's from the larynx, through the release of expired air. So when you release expired air between the adducted vocal cords, the vocal cords will now vibrate. So that's generation of sound. Release expired air through adducted vocal cords to cause them to vibrate. Then there's the resonance of sound. This is by the resonating chambers such as the pharynx, the mouth, and the paranasal sinus. Then there's the articulation of voice, that is through the mouth, nose, nasal cavity, throat, the tongue. All the movements that happen, they help with articulation. So generation of sound is what happens through the vocal cords vibrating, okay, when expired air between the adducted cords vibrate. Then resonance of sound by the chambers and articulation of sound where there's speech production, okay? So we have laryngitis, which is inflammation of the laryngeal mucosa. The laryngeal mucosa can be edematous, accumulation of fluid in the laryngeal mucosa. Then you can have nerve lesions. So external laryngeal nerve lesion can occur unilateral or bilateral. And again, also the recurrent laryngeal nerve lesion can be unilateral or bilateral. Inspiration, the vocal cords abduct. So open up to allow air into the trachea. And during phonation, air will be forced through an adducted. It's adducted, they are together, but you force expired air through. So that way, the vocal cords vibrate, producing sound. So this is showing you inspiration, abduction to allow air, and it can be whichever direction. And this just shows you adducted vocal cords. This is abducted during inspiration and adducted during phonation. So for you to produce sound, you force air in between the adducted vocal cords, making them to vibrate. Okay, so that's it about the larynx. You go back, listen to the video and revise. Thank you very much.